All right. Hi, I'm Julie Uramez with Take One Patient. I am so excited to be talking to my very, very dear friend and respected colleague, Miss Sherrine Washington. So she has been working with dentists across the, not just country, like really kind of all over, about how to really optimize their sales process, how to optimize their communication process. And I think that as we look at different ways to communicate effectively to patients, as we start recording more and more visits, I think taking some ideas from elective medicine, from physicians that actually have more of a pay for the procedures that we're doing mentality, and how we can really apply it into just day-to-day nursing and basic doctor conversations. So today, Corniness here is with Sherrine Washington. Take one. So, Sherrine, so tell me a little bit. About what you do and what you do now for dentists to help them improve the way that they communicate.
Yes. So we know each other from Clear Choice, our days at Clear Choice, working in sales. And I transitioned from working in a sales capacity to really my true passion, which is being a sales trainer. So I'm a sales trainer, coach, and trusted dental advisor. And I train dentists and their treatment presenters how to close 5-figure cases on the same day of the consultation, paid in full. And so a lot of what I do is even just introducing sales, the word sales, to a lot of offices, because that word is taboo sometimes. So I start with that, and then we basically create a repeatable sales process that allows them to drive revenue through the doors of their practice.
I recognize that as far as like sales has this dirty word, even with a lot of our clients, a hospital is still a business, and unfortunately it is the nature of we do have to pay, patients do have to pay, whether it be insurance or right out of pocket, in order to get treatment. Why do you think that is such a hard mentality for people to wrap themselves around, or why is sales such a dirty word when it comes to medicine?
Yeah. Well, I think for most people, when they think of sales, they think back to maybe a bad interaction that they personally had with a salesperson, whether it be purchasing a car or purchasing a high dollar ticket item. And they get this vision in their mind of being backed into a corner and someone pushing them and forcing them to do something. But speaking to your point, sales exists in essentially every business. There's no getting around it, right? But if you see sales from the perspective of this person is coming to me with a need, and I have something that will solve that need. So this is a mutual exchange. It's a conversation to see if what I offer is going to help solve their problem. And I have an obligation to serve this person because they need my help. Right. If we look at it from that perspective, it kind of takes the bad out of what most people associate the word sales with, if that makes any sense.
Right, because I think it goes even back to kind of those old movies, or those old sales movies where, I know more than you, and I'm going to manipulate you and convince you to do something that you don't necessarily need, or that's going to be double what is actually the value is. And so I love that what you're saying is, when we take a step back and stop thinking of that conversation and that, kind of teamwork, if you will, on I'm going to get something from you or you're going to get something from me, and more of, all right, how do we figure this out together?
Yeah.
It really strengthens kind of that conversation and turns it from, all right, this isn't a sales thing, is more of a, mutual exchange of value.
Absolutely. Yeah. This is like a collaborative, right? This is a collaborative effort where I have something that you potentially need, and we're going to talk about it and figure out if this is a good fit. And if it's not a good fit and it's a no for now, that's okay too.
Right.
And if someone in the sales industry is really passionate about what they do, at the end of the day, if what you offer is not a good fit for your client, you should feel okay to even recommend another service for them that's going to be a better fit.
Yeah.
Right. I mean, and that's important.
Right. Well, I think it also goes back to, me as a patient. I would have, or my dad, for example, he had even neurosurgery. So he has no ability to understand, the skill set of the doctor that he's talking to. He has no ability to even recognize, are they awesome at this? Are they terrible about this? I mean, you can see reviews and you can see, if they're board certified and all of those pieces, but there's no way that you have that. The only way that you really can understand, okay, is this a good fit for me? Is this the right person to entrust, my body to, is kind of by the way they come across, is kind of by the way that they are communicating about their skill level and themselves. And so I think, as you said, is that it's like, if it's a mutual exchange of value and a good conversation and a doctor saying, hey, this might not be the best for you, or I might not be the best for you. It's kind of more of that versus like, let me manipulate you and convince you to do something that you don't need.
Yeah, exactly. I always use the example when I go to my primary care. The word sales doesn't even pop into my mind if I'm going to my primary care. But if my doctor said, Sherrine, you're complaining of chest pains, I think we need to have an EKG. If that EKG isn't covered with my insurance, I'm not thinking that my primary care is out to get me. Yeah. In fact, I'm going to say, doesn't matter whether or not my insurance is going to cover it. If you recommend an EKG, let's do it.
Right.
And we take action.
Right.
But why is it different when we have a patient that goes to the dentist?
Right.
And the dentist says, listen, we've got major infection here. You've got 3 teeth that need to be extracted like as soon as possible. Let's go ahead and get this. Why does the conversation change?
Yeah. Yeah.
And why, as a salesperson, are we afraid to help? There's no difference. It's still medicine. It's still the body.
Sure.
Right. So we have to really change our mindset.
Well, and the other space that, you and I have both worked in quite a bit, it's not even just like dentistry, but plastic surgery, cosmetic surgery, bariatric surgery. I learned, getting more into the hospital setting, even a lot of these physicians will say even a hip replacement or a knee replacement. Mm-hmm. It may not be something that's needed right away. It may be something even that you decide to wait 3 or 4 years. But the same thing is you're coming into a situation of, this is something that I need. It may not be an emergency, but I'm coming to you with some concerns. I'm coming to you with some questions about something that is not comfortable with my body, even with my perception of my body. If it's plastic surgery or liposuction, it's like I'm not in a healthy, full, complete space or self. And then come, doctor, help me. And it is kind of like that. It is, yes, it's that communication, mutual exchange of value, but it's also like, all right, let me start educating you and influencing you about what might be necessary.
Yeah, no, I agree with that. And I agree with what you're saying on a personal level, because I'm a bariatric patient. I'm also a plastic surgery patient. I had all the skin removed after I had weight loss surgery. And I always tell people, I went to several different offices to have consults. And I told the patient coordinator that I was paying cash for my treatment. And no one asked me if I was ready to do it. And I was wanting someone to ask me. And if they had asked me, I would have never thought, oh, this person is sleazy. This person is slimy. This person is trying to get my money.
Right.
I was waiting for someone to lead me to help make my decision here, because I wanted it and I had already mentally prepared to do it.
Sure.
But why did I have to go to 5 different offices?
Right. Well, and that's interesting.
To help me.
Yeah, I'm ready to take that step. Just hold my hand and walk with me with it. You know what I mean? I'm ready to do something, because you don't know anything about, that procedure before walking into an office. You're expecting them to kind of be experts, guide out the steps and say, let's do this thing. You made the choice to walk in, let's go. And instead of being like, well, think about it or whatever you want to do, it wasn't that, hey, like walking in was you saying yes before you even came in,
That's it. So, I think that the moral of the story is, why are we afraid to ask?
Yeah.
We don't need to be afraid to ask if a patient is ready. And we don't need to be afraid to be confident and poised and relaxed and having that conversation.
Sure. Well, I think that really can apply, again, even to outside of just cosmetic surgery. Working with a lot of, neurosurgeons, even orthopedic surgeons, a lot of them are in that same space. Is a patient maybe considering 3 or 4 doctors, they may not be considering, do I do it or not? They may be considering different people. And I do think that confidence of, I'm going to take care of you, let's do this thing, does make a patient gain more trust in that provider. Of they're that confident to say, you should do this, let's go. It doesn't come off as manipulative or overbearing or salesy. It comes across as confident. And I don't know, people, they're not thinking I can just say that,
Yeah. Well, and consumers are more educated than we think that they are. And the internet makes it easy for people to kind of like, okay, these are my options. And I think a lot of people look at their options and they are literally looking for a reason to say, nope. All right, I'm going to X this person off. Nope. We're looking for that.
Yeah.
And so as a doctor, whatever field of medicine, what are you willing to do to stand out above the rest, to make it easy for the patient to choose you? Like you said, it gets back to that confidence. It's okay to toot our own horn. It's okay to let a patient know, like, wow, I would love to have you as my patient.
Right.
If as a patient, a doctor said that to me, you would love to have me as a patient?
Right.
Sign me up.
Yeah. Right.
Yeah.
It's that empathy kind of goes with it of like, I'll take care of you. I've got you, in there too. So when you are working, so you work with a lot of different dentists, across the country. What would you say separates the doctors that do not necessarily sell, but do communicate really well from those that don't? What do you think is the biggest differentiator between them?
I think the doctors that get that when they meet with a patient, that it's not about their agenda. Those are I would say those are the doctors that are really successful. Number one, they're not afraid to invest in training.
Sure.
And because training is you don't like pay for training and like, okay, yep, I don't need it anymore. The doctors that realize like, I want to level up. I want to be better in the industry. I want to dictate my own schedule. I want to dominate. I want to be able to have a 3 or 4 day work week instead of a 5-day work week. Those are the doctors that really put forth the effort in being better communicators with their patients. They learn to listen more than talk. They are naturally very, very curious.
Sure.
Yeah. They're open to even changing up how they do things, because a lot of the doctors who I help, I have to like totally revamp how they do things. I have to revamp their patient funnel. If I have them do a virtual tour of their office, I might tell them, nope, you can't present treatment in that room. You got to present it over here.
Yeah.
And those doctors that are like, okay, Sherrine, and they trust me and they're willing to try things and they're willing to see if it feels uncomfortable. Those are the doctors that thrive and do really well at communicating with their patients.
It's so interesting you say that, because we were just, I had the opportunity to work with the director of patient experience and have her on a few of these. And she was talking about, I was like, hey, what are one of the 3 things that you would say in a hospital setting separates, your top communicators from those that aren't? And she said, she had her list of, sit down, and it was a lot of body language. But one of the things that she did say is, she said, they make sure that they're asking, like, what is it that you understand about this? And ask a lot more questions, because the act of making sure that a patient is really comprehending what they're needing and what you can do to help them is a huge piece for patient experience and patients to have a better experience with their provider. And oftentimes the doctor will think, hey, I can just tell you, spend 5 minutes talking at you or talking with you, which is a difference, but talking at you, and you'll know everything that you need. And she says, no, that's not it. It's that extra, 2 minutes of being like, do you understand what we're going to do? Like, are you comfortable with how we're going to move forward? Like, how do you feel about what we're thinking? And really having just even a few of those conversations. I know in dentistry, in a consultative space, there's a consultant's doing a lot more of that. I remember that too. We're talking more even in like a critical care floor or an ICU acute care setting, where a doctor only maybe has 5 or 6 minutes to provide the update that this patient needs. And that's that little time of like, how do you feel about what we're thinking about doing? Do you understand what's going to be happening? Tell me how you're feeling. And just those 3 questions after the piece at the end kind of goes back to just what you said, is takes away from their agenda what they're going to be doing, and make sure it turns into a conversation to learn and listen more than they're talking.
Yeah, yeah, definitely. Yeah. I think that we don't give patients enough credit. I think that a lot of patients, I know, even just speaking of myself, when I go to the doctor, if I don't feel well, I'm almost kind of like diagnosing myself. I think a lot of people are like, oh man, I think I have bronchitis. I need to go to the doctor. Or I think I got this. I think I got that. We can go online and we can diagnose ourselves.
Right.
So when we go into the doctor, I always love a doctor that's like, so what are you thinking is going on? Because like I know my body.
Yeah.
I love to, and I could be wrong. I'm not a doctor, but the
Yeah.
fact that you asked me, you thought to ask me, you already have my attention. You know,
Right.
I think the
Right.
biggest piece of, if somebody says to me, what advice would you give to any doctor? I think the biggest piece of advice, I'm going to be doing a webinar in just a little bit, and we're going to be talking about this, is is really slowing down and watching your pace, and even saying out loud to a patient, let's slow things down for a moment.
Yeah.
Let's slow things down. Like if somebody said that to me in a medical office, I'd be like, okay.
Right.
I'd almost be like, okay, we're gonna slow this thing down.
All right, let's lean back here.
Like, okay.
Yeah.
And now you have my attention.
Yeah.
Because you're telling me just the idea of that, and changing your tone and your inflection and your voice helps me to be at attention, because now you're getting ready to say something to me that's very important and I need to be listening.
Well, and it's interesting even the way that you're saying that again in your space, and thinking about my nurses and my doctors that are in a more of an acute care setting, where they're going in and rounding on each patient in the morning, oftentimes like 5 a.m., 5-10 minutes they're going in each room. That even if they know I only have that 5 minutes to be in there, that they come in and say, okay, I'm going to sit down with you for a second, which was a great, idea someone else had provided. And we're going to slow things down and we're just going to talk. Even if they spend the same amount of time, the perception of that patient is I have nowhere to be. I'm going to be doing this like slowly and calmly. And we're going to make sure that we're both in the same space. But as you said, as a patient listening to that, all of a sudden I'm not thinking about the list of what I need to do. I'm not thinking about what I'm gonna have for lunch. I'm not thinking about the fight I had with my boyfriend. Like I'm not thinking about any of that. I'm like, oh, we're okay. I'm with you. We need to fit in.
We're right
it
here.
reminds both of them. And it's so even if a doctor's saying, I'm gonna sit down, I'm gonna slow things down, and we're gonna have a talk, that little agenda of making sure that the patient says, hey, this is what this is gonna look like for the next 4 or 5 minutes of our dialogue. It's not necessarily about spending 20 minutes. It's making sure that little bit of time is used effectively.
That's it.
I love that. I'm like thinking about it as you're saying, of like how applicable that is into this hospital settings of, let's just take a minute. We're going to slow down. And it gives you that mental note as well as makes the patient have that mental note. I love that. That's great.
Yes.
That's so applicable.
Mm-hmm.
Awesome. So medical memory I work with, that they use video where they're actually then recording those conversations. So, you have that slowdown, you have that check-in. So not only the patient can re-access it, but also the family members can access that, which makes me think about, gosh, what a great even perspective for a family member to see a doctor saying, hey, I'm going to come in and we're going to slow things down and let's really sit and talk for a minute about this. So that's how we're using medical memory. Now you use medical memory in a totally different capacity, where you're actually not giving the patient necessarily a copy of the video, but more so using it to record the doctor and provide feedback on the way that the doctor is communicating about their consultation. What made you start to even think about using video as it relates to improving communication?
Well, I wasn't a big fan of having to be recorded years ago, working as a consultative salesperson. And it was mainly because I looked at it the wrong way. And I thought, well, somebody's looking at my video as I'm doing my consultations to judge me or to see what I'm doing wrong.
Right.
It wasn't until I really started watching myself on video that I had such an appreciation for it, because there were a lot of nonverbals that I was guilty of that I didn't realize. my facial expressions, my ability to catch where someone maybe wasn't quite understanding what I was saying. I wasn't looking at their body language that would help me to really um, clear my message. And now that I have my clients using video, it's a game changer because, well, it's the closest thing to me being there without doctors having to pay me to actually fly to their office.
Sure, sure.
But it's really focusing on the things that they do really, really well, because it's not just the doctor, it's the treatment coordinator too. But then it's those missed opportunities that because they say things, it becomes their song. And they say things all the time that I'm able to provide them with really great feedback and saying, instead of using the word cheap, like we got to think of another word that we
Yeah.
can use instead of saying cheap because it devalues the treatment. Can we say that another affordable option might be? You know, I'm
Yeah.
also noticing with medical memory and watching, it's so powerful. I can watch a medical memory video, and when I'm done, I can confidently say as a coach, I know exactly where that went wrong. I know exactly the moment down to the minute on the video where it unraveled. Like
Yeah.
you had it,
Yeah.
but then it like went this direction. And here's why.
Yeah.
All right. And then here's why we don't do it here, but then maybe that conversation you put it here.
Right.
It's so dynamic. The key is you've got to have people that are open to hearing the feedback. And
Right.
say, oh, okay, yeah, you're right, as opposed to somebody like resisting it. But it's so powerful.
What you almost said, which was interesting, is and correct me if I'm wrong, is that the first thing that when you started using video, is the first thing was just simply seeing yourself. Like even if you don't have a coach, even if you don't have anybody that's able to look at these videos. So even for like again going back to any nurse or any doctor, maybe taking one day to say, I wonder how I come across, and watching just a couple of their own videos in and of itself would have a pretty profound effect in shifting some things that they would do communication wise.
Absolutely. Yes. Yeah. And when you start doing it, you're looking at the wrong things. Oh my God, that angle, my chin, I look fat. That. You're looking at all the wrong things.
Right.
We don't need to look at that. We just need to look at my hands, my face. One of the first things I noticed in video was that I did this a lot. And I wasn't even listening. I could tell that I wasn't listening because the patient would ask me a question and I had to say, can you say that again?
Yeah.
I was doing things like subconsciously. I wasn't even aware of it.
Yeah.
And then when I wasn't on video, I was like, okay, I had like this internal dialogue before I, did my consult. That's like, okay, so I'm not going to do this. I'm going to work on this and I'm going to work on that. So you're almost like coaching yourself.
Yeah. No, for sure. Well,
Yeah.
I still remember when I watched myself on video the first few times. I could not believe how fast I talk, and I still talk too fast. It's just my like learning how to sell on the East Coast and in New York,
Yeah.
But yeah, and I was like, this patient is missing even half of the things that I'm saying because it's just too fast. And I should have taken that advice of like, okay, we're just going to slow things down. And so I feel like, let's really talk about this. It would have been a good like mental check to be like, okay, so we're just going to slow things down and like, let's make sure we're on the same page. Even having a moment of that in that big, consultation, I couldn't believe how fast I talked. And it was a huge like gut check of like, Jules, like, my goodness. Like,
well, and that's another thing. I mean, I'm from New Jersey, so there's a lot of like cultural, like, nuances that we have. It's sort of ingrained in us. It doesn't mean that we can't change it, but certainly we need to be aware of it. Talking fast, talking too much, being overly animated. I mean, these are all things that can be tweaked.
Yeah.
If you see yourself doing it.
Honestly, see yourself honestly. Yeah, absolutely. So I love this, Sherrine, and I love already that one thing you said as far as this is a great way to just like make sure we're on the same page. I'm going to slow things down. That's my biggest takeaway. Or what do you say? You say in your things, you're like, this is your one. What do you call it? It's like your hot thing. I can't remember. I watched one of your webinars once, and you're like, "This is the one thing you should remember. Write this down."
I do say, write this down. I do always say, write this down.
Write this down. So what outside of, that piece, what would be the other kind of two biggest things that you would say in your space would be useful for, knowing what you know about nurses or doctors and kind of what I've explained to you? What would be the other two things from your expertise do you think that they could also add outside of like that, let's slow this down, and reminding themselves to slow down? What would be two other things?
I would say checking in. And checking in very early in the conversation. I think that when I watch doctors, or I watch anyone who comes into the room for the first time, we jump in immediately to like our purpose.
Yeah.
And I think that we have to like stop for a second and think, we don't know what happened to this patient even before they like got there. Like, we don't know if they, were in traffic. We don't know if they were in an accident. We don't know anything. And so I think going into the room and just saying, how's your visit been today? And being mindful of how you ask that question.
Yeah.
And pausing.
Yeah.
Actually just counting in your head 3 seconds. How has your visit been today with our team? And then letting them respond. And then when they're done responding, count to yourself. 1, 2, 3.
Well, and that's so applicable. And that's so applicable of like, how are you feeling today? How is the nurse team treating you? How have you been treated at your stay? If they've been there for a little ways of even if it's something a doctor can't do, like, oh, I'm just cold, or I'm hungry, or I'm nervous, like, at least that I'm heard. Someone's asking me and I'm going to be heard is huge.
And how you ask, right? So most people, if they're coming in, they have a clipboard or something and they have papers. They're like, hey, how are you doing? All right today? All right. So what we're going to do is the way that I just said that is like, okay, check, check, check. I don't even care what the person said. They could have told me they had a bad day. I'm just asking because I know that's the right thing to do.
Yeah.
If you come into a room and you say, hi, I'm Sherrine. Your name is? Nice to meet you. You doing okay today?
1, 2, 3.
No, right? There's a difference.
Yeah, there's a difference. There is a difference. There's a big...
It's just how you do it.
Yeah.
Slow it down, really listen. And if the person says, oh, today was an okay day, some people would say, okay, great. Well, actually, no, it's not. How difficult is it to say, are you sure?
Yeah.
I'm not too convinced.
Yeah.
No, I had a horrible day. Some people just want to say, they want to share.
Yeah.
Right? That in itself builds trust.
Yeah.
People are wanting, especially now with COVID, everything has changed. You go to the doctor now, there's all these formalities. You got to call before you go in. You got to have your mask. So we have dehumanized really patient interaction.
Yeah.
It's tough. I don't even like going to the doctor now. You got to call. And then sometimes they're nasty. Well, we're going to come get you. And then you come in. So what can we do?
Yeah.
Despite the world that we live in right now, to really help people feel important? Because the world that we're living in right now, it brings us down a notch. So it's the small things,
Sherrine, you're a treat, always. I just so appreciate your intellect and your wisdom. And I think, so many of the things that you're saying are so applicable. It's just crazy. So, I love what you're mentioning. You're like, these are the hot things. These are the things that write down. And I think as we kind of, continue to, record patient videos, we've recorded, about 88,000 videos. I think these little tiny nuggets that take no time, like very little time, can be so applicable to make people feel more comfortable recording themselves, more comfortable giving patients these video messages, and just feeling like more equipped with tools in their tool belt, to really give that patient a great experience. And eventually, the more they practice it, they don't have to think about it. It's just, this is what I do every time. to get into that comfortable space. So thank you so much for your time and for teaching us about your world a little bit. I appreciate you. And
I appreciate you for having me.
Yeah, I know. All right. Thank you so much.